So I will do it in English, okay? Any questions, please feel free to jump in, okay? So first of all, I thank you everyone for coming to this event, even though it's raining and on a Sunday. It's a noble cause. October is Breast Cancer Awareness Month. Everybody knows that. I generally like to keep my talks very interactive, not boring, give a bland lecture, okay? So I want you all to pitch in. Don't think it's a right answer or wrong answer. Please feel free, okay? So I'll just tell you why we celebrate or we do this as an October Breast Cancer Awareness Month, right? This is mainly, the whole month of October is dedicated in educating women about breast cancer screening and also detecting breast cancer at an earlier stage. That's the main goal of this. Okay? And I thank APTA and the organizers, Raghu Visam, Ramji, and Murli Krishna for joining hands in this noble cause, in spreading the knowledge about it. And I'm truly honored to be here, to be part of this and giving this talk, okay? As a woman myself, how I like to think about is, if somebody says do a test, first question comes is, why should I do this, right? And then, what is the risk of me having a cancer? Why should I go through this? What are the side effects of this screening test or whatever we're going to suggest, right? What age should we start? How often should you do? When can you end? Those are some of the questions that run through my mind. Is that what you all think?
Yeah.
That's a better approach, right? So the first thing is, I'll ask you one question. Anyone can pitch in. What is a screening test? When they use the word screening test, you go to your GYNs or primary care. They say, oh, you have to screen PSA this year. You have to screen A1C. You have to do mammogram. So what does a screening test mean?
Initial test?
Yes, that's good. So you're pretty close. A screening test is actually a test to detect a disease before you have symptoms. Okay? That means you are proactively trying to find it when you are healthy. Right? So that's the main purpose of a screening test. So there are screening tests for other things, like I just said. Then why should you get screened for breast cancer? Right? That's the common question is why? Why should I? Right? Why should we screen for breast cancer is because being a woman, right? Breast cancers happen in women. 99% of the breast cancers happen in women, right? And then it's the second common cause of death in women is breast cancer. It is bad, right? We probably heard of aunts, uncles, some parents have breast cancer, they died from this, it spread there, it spread here. It's an overwhelming disease. So the goal is to proactively go find it at an earlier stage. That's the whole reason of why we screen for breast cancer. Why? Because if you detect it early, you might not need extensive surgery. Nowadays, they don't even necessarily have to do a mastectomy. They do a minimal invasive surgery. You don't need a big chemotherapy. They can just do an hormone replacement therapy. So less treatments, less surgical options, increase its survival. Increase its survival is the biggest thing that they saw doing this. The prediction is 1 in every 8 women in US will develop breast cancer by the age of 75. So it is that common. So therefore it is important to get it screened and find it early enough. That's why we do the screening. So you might ask, did it really work? You might have asked that, right? So in the last 50 years, doing the screening test, they significantly reduced the number of women dying from breast cancer, meaning breast cancer deaths in women has gone down far. It's not, though it's number one cause of cancer in women, it's not number one cause of death in women. How did the transition happen? That's because of the screening test. So I just want to emphasize why it should be screened. Okay. Any questions?
You said 8 out of 10 women, right? Is that only
1
for-
out of 8.
Is that only for Americans or even for our Indian?
General women. This is mainly American data,
Okay.
but all over the world it's very common.
Oh.
I mean, is it added in the annual checkups and all, or it is not currently
No,
within?
absolutely. So that's where I'm getting. Is yes. When you go to your yearly physical, either GYN or PCPs, they say, oh, you should get mammogram. But then a lot of women think, why should I get it? Like, most of them are